previous videotape, we dissected the association bundles and the optic radiation from the lateral side. We'll now remove the insula and approach the basal ganglia from the lateral side. Before we go to the specimen, take a look at this drawing. Here is the insula, and we will dissect the following structures: the insular cortex, extreme capsule, claustrum, and external capsule, until we come to the lateral surface of the lentiform nucleus here, which is represented by the putamen. Insula is an interesting structure. It's closely related to the rest of the cerebral cortex and primarily to the temporal and frontal areas. As a matter of fact, all 5 sensory modalities are represented in insula: olfactory, gustatory, also autonomic functions in the rostral part, and visual, somatosensory, and auditory responses can be recorded from the posterior part of the insula. But the overall function of the insula is not well known, so let's take it away. Now, you have to be very careful. First, we'll take away the insular cortex. Now, do it a little bit carefully here so you don't strip away the extreme capsule in the process. Here we go. Be careful, like this. So now what you see here, this whitish area, is the extreme capsule. Now we will take away the extreme capsule very carefully here, like this. Here we go. Okay. And as you can see here, in the more rostral part now, then we have taken away the extreme capsule. This grayish area located here is part of claustrum. So what we'll do now, and it is especially well seen in the ventral part here, now we will scrape away the gray substance of the claustrum like this. Here it goes. And then, of course, we will reach the external capsule. Here goes the claustrum, as you can see, like this. And now what we have left is the external capsule. Let's see here. We'll go in underneath here, take away this whole lamina. Here it goes. So you can see, look at that. Here comes the putamen, the lateral side of the putamen. Look at this, beautifully. Here we go, the more ventral parts. We'll take away here the uncinate fasciculus, a little bit in the ventral part here, like this. So here you can see the extent of the putamen, the lateral surface of the putamen. Before we turn to the medial side of the hemisphere, take a second look at the optic radiation, the extent of it. Here it is. And here are the fibers in the Meyer's loop coming out here underneath the lentiform nucleus, swinging forward laterally on top of the temporal horn of the lateral ventricle. We will now dissect from the medial side. And the large association bundle that we will look for is the cingulum, which is located in the core of the cingulate gyrus. Here it is, coming from the area of the subcallosal area here, swinging around the gene of corpus callosum, on top of corpus callosum, behind the splenium, into the core of the parahippocampal gyrus, to reach the most anterior part of the temporal lobe. Well, please remember, this is not just a telephone cable. A large amount of fibers are coming in and going out of the cingulum at different places. Look in this drawing. This is the fornix coming out here underneath the splenium, originally from the hippocampus in the temporal lobe, And it makes this beautiful arch in front of the thalamus to reach the mammillary body here. We have also dissected free the mammillothalamic tract, coming here from the mammillary body and reaching the anterior nucleus of the thalamus. This is the medial side of the hemisphere. Let's orient ourselves. Here is the frontal lobe. Here is corpus callosum with a cingulate gyrus on top of corpus callosum. In the back here, this is the parieto-occipital sulcus, and here is the parahippocampal gyrus here with a hook-shaped uncus in its anterior part. Cingulum is located here in the cingulate gyrus. So what we have to do is to take away the cortex of the cingulate gyrus like this to get to the cingulum. Here in the rostral part like this. Now we have dissected free the bundle in front of the gene of the corpus callosum and all the way towards the subcallosal area in this part. Now let's clean up a little bit on the rest of the cingulum here so you can see it a little bit better. Here it is in its posterior part. Better grip on the, here it goes. Behind the splenium, here as you can see, take it away and can follow it all the way down towards the temporal pole, as a matter of fact. We'll clean up the bundle here, the area around the bundle, so you can really see this bundle in the temporal lobe here like this. We will go to another specimen. There is a better contrast between white and gray matter, and as you can see, we have already dissected out the cingulum. And this is the most massive association bundle on the medial side of the hemisphere. As you can see, it almost completely encircles the corpus callosum and the brainstem down here. It is also the bundle that is sometimes transected in modern forms of psychosurgery at about this level. This type of stereotaxic surgery, called cingulotomy, is a last-ditch effort, as it were. It's used only on patients who are incapacitated by severe emotional disorders and who have not responded to any other form of treatment. We will now remove the cingulum in order to see the radiation of the corpus callosum. We will insert a scalpel here between the cingulum and the corpus callosum and simply lift off this large association bundle. And if we do that, we will be able to see the commissural fibers here radiating from the corpus callosum into the cerebral cortex. Look, we cannot follow them further until about this level, because here they interdigitate with other types of fibers, association fibers and projection fibers. Well, let's do this on the specimen. In order to remove the cingulum and expose the radiation of corpus callosum, let's first take away some of the gray and white matter here on the medial side, like this specimen here. And then what we will do is to insert the blade here underneath the cingulum like this and simply lift it away like this. Lift it up all the way back here. Okay, that's part, and we remove it in the front here like this here. And then we can clean it up a little bit and follow the radiation of the corpus callosum, as you can see here, like this. A little bit further back like this. Here we go. And then we can even strip away this part of the cingulum that goes around the splenium here, like this. You take it away, like this. Now we should be able to see nicely, if you get in a little bit here, the radiation of the corpus callosum, like this. Of course, cannot follow it further than till about here. We will now cut off the free medial part of corpus callosum and remove it together with the septum pellucidum and the fornix here. We'll cut off the fornix column at this level of the interventricular foramen, and the crus foranis is here behind the thalamus. Then we'll strip away all of these parts, and then we'll look down into the lateral ventricle. And what you'll see in the floor of the lateral ventricle is medially the thalamus and laterally the caudate nucleus. And we'll strip away the gray substance of the caudate nucleus, and gradually we will come up with this picture that you see here. Here it is. These are the very first glimpse of the internal capsule that you will see here. And the caudate nucleus was located in this region. The first part of the internal capsule that you will see are fibers between the cerebral cortex and the thalamus, this blue structure here. So what you see here really is the thalamic radiation. Well, this is great excitement, as you'll see on the specimen. Before we focus our attention on the radiation of the internal capsule, let's just, for the fun of it, go down here into hypothalamus. Here is fornix. Dissect free the fornix and follow it to the mammillary body. Look here how it can be laid open like this, all the way down to the mammillary body. Here it is. Here it goes. Nice. We might even be able to see if we can get here into the mammillothalamic tract. Look here, here it comes. Take away, look there, there is the mammillothalamic tract going up towards the anterior thalamic, and take it away so you can see it a little bit better. Here goes the part of thalamus. Here it is, the mammillothalamic tract. Here. And the column of fornix. Well, that was an interlude. Let's now turn to the radiation of the corpus callosum, as you see out here, radiating out into the hemisphere. What we will do is remove the free medial edge of corpus callosum together with the septum and part of fornix. And when we do that, what we actually will do, we will open up into the lateral ventricle. Here is the interventricular foramen, and as you know, behind the septum is the lateral ventricle. Well, that you can easily see because there is a hole here in the septum. Well, what I'm trying to say is, it's very good to know what you are going to do before you do it. So that's the reason for looking at frontal sections in your book before you do this. Now, what we'll do, we'll make a cut like this with a knife, and take away this medial part of the corpus callosum. You will also cut through the fornix column here in the front. Then we can simply lift away this part like this. Here it goes, like this. And we'll go a little bit deeper now, and we can see what we are doing, like this, here, all the way around towards the splenium. Take this away. And then we have opened up into the lateral ventricle. So the large structure you see here in the rostral part is the head of the caudate. And of course this is the thalamus with the choroid plexus here in the lateral ventricle. So the next thing we have to do is to remove here the head of the caudate, look, and see if we can catch the radiating fibers coming from the internal capsule. Well, the first fibers we will be able to see are really the ones coming from the thalamus. Look here, this is the first thing we will see of the radiating crown, and it's really part of the thalamic radiation. Follow it all the way out. Here goes again, like this. A little bit further back here. Take away. You have to force your way a little bit here, because after all, this is the place where the projection fibers interdigitate with commissural fibers and with association fibers like this. But anyway, this, as you can see, we have now scraped away most of the caudate nucleus here in the front too, like this. So the thalamic radiation, thalamocortical and corticothalamic fibers. We will now expose the full extent of the internal capsule by removing first the thalamus here, and with it the thalamic radiation. And we'll then be able to follow the fibers from the cerebral cortex as they converge towards the deeper part of the internal capsule. If we also remove the dorsal part of the mesencephalon, dorsal to the substantia nigra, we'll be able to follow them all the way to the base of the peduncle. However, be sure you don't remove the base here. If we do this, we will come to the grand finale in this dissection. Here it is, the internal capsule in all its beauty. You get the impression here of a radiating crown. Most of the fibers converging on the base of the cerebral peduncle are corticofugal fibers, corticopontine, corticobulbar, and corticoreticular fibers. The corticospinal tract, or pyramidal tract, coming here from the area of the precentral gyrus, represents only a small part of this fiber system like this. Here is the premotor cortex. Also contributing to the pyramidal tract. Before we expose the internal capsule, let's look again about the relations here in the rostral part of the hypothalamus. Here is the optic tract coming in, the optic chiasm, and this is the rostral part of hypothalamus. As a matter of fact, let's take it away here. Here is the mammillary body, but we'll preserve that, take away this part of the hypothalamus like this. Remove it, flip it aside, and then very nicely you can see here fornix coming down here towards the mammillary body here, lifted from its bed. And here again, look at the anterior commissure in front of fornix, the anterior commissure. Can you see how it disappears into the ventral part of the basal ganglia here? Now, this will be exciting, because what we're going to do, we're going to take away the thalamic radiation, thalamus, and we have already taken away part of the hypothalamus and thalamus here, and we will also take away here the dorsal part of the mesencephalon, but preserve, as I said, the base of the peduncle. And then we will be able to expose the whole part of the internal capsule. So here I go down in the internal capsule like this. Here comes, go from this side. Now we'll take away the thalamus here, as you can see. Look at the fibers, how you can follow them. Again, here, and go a little deeper. Take away here the dorsal part, as you can see, of the mesencephalon. All right. Here it goes like this. And a little bit further back here. Look at this. You can follow the radiation of the internal capsule like this. This is the full extent of the internal capsule, from posterior all the way to the anterior part. Now you see beautifully the radiating crown up towards the hemisphere. The fibers you see coming down here towards the base of the peduncle are practically without exception corticofugal fibers. And the corticospinal tract, the pyramidal tract, is located here in the center.